Let's talk about cardiopulmonary resuscitation, or CPR. CPR is needed when a person is unresponsive and not breathing. If CPR is started quickly and done well, it can actually manually move oxygenated blood through the body and achieve about a quarter of normal cardiovascular function. This means that a person who otherwise would have a very low chance of survival after 4 to 7 minutes without oxygen circulating now has an extended window of time in which they can be resuscitated. First, we need to make sure that the scene is safe to approach. Determine what happened and how they got to the ground to see if we need to be concerned about a potential spinal injury. Are they awake? Check to see if they respond to your voice or squeezing their shoulder or hand.
Are you all right? Are you okay?
Are they breathing? Check for signs of normal breathing for no more than 10 seconds. If they're not responsive and not breathing, have someone call 911 and bring you a first aid kit, blanket, and AED.
I need you to call 911. I have an unconscious person here. I'm at 123 Lollipop Lane. I'm going to need an ambulance and an AED right away. Do you understand?
We're now immediately going to start CPR, beginning with 30 chest compressions. Interlock your fingers and place the heel of your hand on the center of the person's chest. Push hard, at least 5 centimeters, and push fast, 100 to 120 beats per minute, until a first aid kit arrives. If we're not pushing deep enough, we risk not moving enough blood through their body to make a difference. For adults, this means sometimes we may hear cracking or feel crunching sensations as we do damage to the cartilage connecting the ribs to the sternum. This is not life-threatening, but not pushing hard enough definitely is. When that first aid kit arrives with your CPR barrier device, place it over the person's mouth and nose, seal it, tilt their head back, and give them 2 gentle breaths. If you don't have a barrier device, it's okay to continue with compression-only CPR, where we just give continuous compressions and skip the breaths entirely. Continue with 30 compressions, then 2 breaths until they wake up, another person takes over, or an AED is set up and ready to shock.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 20, 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9 and 30.
CPR is tiring, so ideally you'll switch with another person about every 2 minutes or 5 cycles of CPR. If your first breath does not go in and you feel resistance instead, reposition the person's head and try again. If the second breath doesn't go in, assume this person has an obstructed airway. Continue CPR, but look in the person's mouth every time you finish 30 compressions to see if something was dislodged. If you see something in their mouth, quickly roll them into the recovery position and use 2 fingers to sweep it out of their mouth. Unless there are obvious signs of life, return immediately to doing CPR. Don't expect the person to wake up like they do in movies. Most likely, you will need to continue CPR until the ambulance arrives and they take over. Try to keep it going, rotating with other helpers about every 2 minutes, and keep pauses to a minimum. If the situation becomes dangerous or help is not close and you're exhausted, you may need to stop CPR and care for yourself. Performing CPR is often a traumatic experience, and the outcomes are often uncertain or unfortunate. It's important to care for yourself physically and emotionally afterwards. Watch for signs of critical incident stress and seek out support if you need it.